Have you been diagnosed with renal cancer, also known as kidney cancer? I'm Dr. Nathan Goodyear, Medical Director here at Brio Medical in Scottsdale, Arizona. When you look at cancer, everything needs to be precision-based. The old concept was that cancer was born out of genetics. Definitely genetic mutations are a part of cancer, but most of that is from the development of the cancer. As the cancer develops, it mutates and it affects the environment, what's called the tumor microenvironment, and that affects the immune system. These and many other pieces come together to allow cancer to survive and thrive and spread. When you look at renal cell cancer or kidney cancer, it tends to be a cancer that's very immunologic, meaning the immune system is intimately involved in how cancer is growing and spreading. So what happens is cancer is evading the immune system. There's a wide spectrum of how it does it. It creates dysfunction within the immune system. But what we want to do here at Brio Medical is we want to be precision-based in how we approach the targeting of kidney cancer. So looking at all aspects of contributors to disruption of the immune system is going to be imperative here. Looking at the stress response, looking at neurotransmitters because they affect the immune system, looking at the gut because of how it affects the immune system. I've talked about this before, but how the gut microbiome and the inflammation and the gut bacteria balance, how that disrupts the gut inflammatory process, and then that in turn disrupts the inflammatory process within the tumor microenvironment. There is bacteria and fungi within the tumor microenvironment, and that communicates with the gut, so we need to understand that process. But what we want to do in targeting renal cell cancer or kidney cancer is we want to really target the immune system. So oncolytic viruses are something that we use here. Rigvir out of Europe helps us to really target the tumor but not the healthy cells. This is a non-pathogenic virus that targets the tumor and helps to get the immune system involved. High dose vitamin C, of course, and it's very important to understand we must therapeutically dose the vitamin C. Everybody recognizes a 6'6", 350-pound person is going to require a different dose than a 5'2", 110-pound person. Following the plasma levels to ensure that we are achieving a therapeutic level is imperative with vitamin C, and that stimulates the immune system. Mistletoe, of course, very important as an immunomodulatory therapy, both IV and subcutaneously, even nebulizing it. You can even use that up in the bladder as well. Ozone, very important in immunomodulation therapy as well. But very important here would be IPT, low-dose metronomic chemo, along with hyperthermia. These two therapies are very powerful immunomodulatory therapies, meaning they're modulating the immune system, using the immune system, targeting the immune system to target the tumor. What I tell people about cancer is the best answer to cancer is to not get it. But if you have cancer, the best answer to cancer is the immune system. And IPT, or low-dose metronomic chemo, is a immunomodulatory therapy, and that's one of the problems with full-dose chemo is it destroys lymphocytes, it destroys the immune system. But what IPT does, it actually stimulates the immune system. We see this repetitively with our patients. By following their lymphocytes, by following their immune system through treatment, we see their immune system get stronger. When the immune system gets stronger and you target against the tumor, that is a therapy that is going to build and build and build success. But then combine that with hyperthermia, which is mimicking a fever, and the fever is simply the manifestation of a strong immune system. So we're basically shock charging the immune system, but also targeting the tumor. By bringing these therapies together and many others, some oral supplements, some even targeted therapies that are prescription medicine, but using them in a low dose but targeted way and bringing these together allow us to stimulate the immune system, target the immune system, and actually get the immune system doing its job, turning it on the tumor, destroying the tumor, targeting the tumor, yet healing the body, here healing the immune system. Novel concept, I know. Target the tumor and heal the body. It can be done. That's what we do here at Brio Medical. Evidence-based, precision-based care here at Brio Medical. To learn more about what we do here in the treatment of renal cell or kidney cancer and other types of cancer here at Brio Medical in Scottsdale, Arizona, I encourage you to check out our website, learn much and many more information there about how we approach cancer from a healing perspective. I look forward to meeting you and talking to you soon.